under eye, fine lines and wrinkles, under eye, just crepey skin, under eye laxity. This is something that people come into me complaining about in my office at like all ages, whether you're in your 20s, 30s, 40s, if you're post-menopausal. I feel like everybody has this area as like a problematic area on their skin, on their face. And the reason why is because the under eye area is like the first to show our age and the first to show the signs of aging, because the minute you lose collagen and elastin in the under eye area, that skin is so thin, especially like when you smile, you'll start to notice fine lines and wrinkles like as early as your 20s, because that's when collagen breakdown starts to happen. So it's a sad but ugly truth. When I was in my early 20s, and I learned this when I was pre-med and in medical school as a student, I literally went and I Fraxeled and did lasers under my eyes before it was prejuvenation was even a thing. And I'm glad that I did it, because even in my early 20s, when I would smile, I would get like under eye fine lines and wrinkles. But by building up those collagen stores over time, now that I'm almost 50, I think that it really has like paid off. So increasing collagen stores under the eyes helps smooth fine lines and wrinkles and keeps that under area tight over a lifetime. And there's no amount of surgery that's ever going to be able to do that, because even if you did surgery with a loss of collagen and elastin in that area, you're going to be back to your baseline with thin crepey skin, but now with a scar. So hopefully after watching this video, you understand non-surgical treatments for under eye smoothness and tightness beginning in your 20s, and even if you're late to the game and want to smooth out your under eyes in your 40s, 50s, 60s and beyond, hopefully this video will be helpful for you. So I don't want you guys to be discouraged if you're like late to the game and say you've never taken care of your skin and you're noticing fine lines and wrinkles and your under eyes have laxity and stuff, and you've never really taken care of it and now you want to start. Your skin is a very dynamic organ system. So just like when you go to the gym and you like work out and you build muscle, you're basically stressing your muscle, overworking it, overusing it, tearing down the muscle fibers, and then you're going home and you're eating your protein, and then you're getting stronger, and then the next time you go to the gym, you're able to lift heavier weights and you don't get as sore. And so the skin is very responsive to stimuli. And so I don't want you to think that if you're older and you haven't taken care of your under eyes, like, oh, I didn't start like Kappa when she was 22 doing Fraxel under her eyes, like it's, I'm a lost cause. That's not it at all. Your skin responds to stimulus and to, lasers and tightening devices and radio frequency and things that are going to upregulate collagen synthesis by the fibroblasts, which are the collagen producing cells in the skin. So I've seen people completely turn around like their skin, especially in the under eye area, when they hadn't previously been taking care of it before, or previously taking care of their skin before. And so I don't want you to be discouraged. So at any age, if you want to start early on and kind of prejuvenate and set yourself up for, a lifetime of, having healthy skin, having tight under eyes, I think that that's a good thing to do. And those were things like using eye serums, starting at a young age. I mean, I think I started at like 17 using, an under eye serum. And before I was able to, buy my own and like afford an eye serum, I would just use Aquaphor under my eyes. So any little bit helps, and you don't want to wait until you're older, to start these prejuvenation treatments and like, preventative treatments. So for all my young beauties out there, eye serum, or if you can't afford an eye serum, just like a, $13 Aquaphor, just put it under your eyes at night. Never let that skin get dry, or never let that skin not be like hydrated and, moist. So I think that that's really important. And then, if you're in your 20s, 30s, 40s, and you want to get on to the under eye tightening game, then I think just investing in like a laser. So there's different lasers. You have ablative and you have non-ablative. Ablative lasers are like Erbium, CO2. They can be fractionated or not fractionated. And in English, what that means is fractionated lasers just treat like a fraction of the skin. It doesn't treat all of the skin. It just treats a fraction of the skin. And for that reason, there's less downtime. There's a quicker response rate. You can kind of get back to work faster without having to like be home and like hiding, doing vinegar soaks and, not really being able to like live life, because the fractionated lasers are just treating zones of little, they call them columns of thermal damage, even though it's not, it's not damage to the skin in a bad way. It's damage because you're upregulating almost like an induced wound healing environment, which stimulates collagen and elastin and all those extracellular matrix proteins that you want in the skin, because that's what tightens the skin. So because you're treating a fraction of the skin, it's not as severe with like the downtime. Now fully ablative lasers that are not or full field lasers that are not fractionated. Basically, it's like taking like a lawnmower and going like over the skin. You're not missing any areas. It's not sparing any areas. Versus fractionated is like little carpet bombs. You're poking holes in the skin, which, you know, has a quicker turnaround time, but also is like less uncomfortable. So that's what we mean when we talk about fractionated versus non-fractionated lasers. And then you have ablative and non-ablative lasers. Sorry, I'm just like, I'm trying to make my skincare products dry. So you have ablative and non-ablative lasers. Let me get a Q-tip, hold on. And ablative lasers are just like, basically when you ablate the tissue, you're vaporizing that tissue. Like that tissue gets disintegrated and it's like literally gone. Versus non-ablative doesn't like remove any tissue, but it basically just heats up the tissue and stimulates synthesis of new collagen and elastin fibers, and also like, you know, cellular turnover and things like that. So it doesn't remove the skin, it just heats it and upregulates it to act and behave younger. When you remove the skin, that also can upregulate collagen and elastin synthesis, but it's a little bit more severe. Ablative lasers have more like little pinpoint bleeding, more redness over time, you know, over the 2 to 6 months after the laser treatment, you might be a little pink, or what we say in dermatology, erythematous. And then the non-ablative lasers, you're just more like pink and puffy and sunburn looking, like a Fraxel Dual or a Fraxel Restore. And you don't have any bleeding or anything like that, or bruising. You're just more just like, you look like you pink and puffy, like you have a sunburn. So both work really, really well. And I think that it's just a patient preference with respect to your downtime. But I seriously think that my favorite laser for, hold on, I'm looking for my retinol. I seriously think that my favorite, where's my retinol? Wait, hold on. I seriously think that my favorite laser for under eyes, if you're just getting started, is a Fraxel Restore, or, you know, Halo is another fractionated laser that's like ablative and non-ablative. I like Fraxel Restore better than Halo, and I really love it as a non-ablative laser for people that don't have that much downtime and just want to like tighten and firm the under eyes. I know you guys are going to ask me about Tixel. I haven't been really impressed with Tixel, which is why I don't have one. I'm just being honest. I'm not sponsored by any company, so I don't have to worry about, you know, saying something great about a company. I don't, you know, I'm not an affiliate or any contract with any companies at all. So I love Fraxel Restore. I love, for one step above that, I love a fractionated CO2. I have the CO2 core. I love that one. I did a YouTube video last year when I did it on myself and my skin was like glowing. I really, really love that. And if you want to take a step above that, we have like the Erbium Contour TRL or Pro Frac. And so I don't want to confuse you guys with too many lasers, but basically you can kind of go from like small, medium, large with respect to, you know, how much power the laser has. So if you have a more aggressive laser, of course you have better results, but also that comes with more downtime and it's usually more expensive. And sometimes the lasers like the Erbium Contour TRL, not all Erbiums are created equal. The Contour TRL is like a beast. It's the most intense laser I've ever used, and as a laser expert and a laser fellowship trained dermatologist, and I've had access to everything. In my 20 years of my career, I've never seen a laser this strong or this powerful, but also, you know, even having the training to be able to use and operate this device, I just proceeded with caution, and I've had it for about a year in my office now, and it's just amazing with what it can do, especially for under the eyes. So for a laser like that, you wouldn't have to do the full face. You would just maybe just do under eyes, contour TRL, one and done treatment. And I usually don't say that about a laser. I never say any laser is like a one and done treatment, because it usually takes multiple treatments to get a result. But with the contour TL, it's amazing. But the downside is that it's a lot more downtime. It's 2 weeks instead of 1 week. And for that 1 week, like, you're not like, you know, putting tinted sunscreen on and running to Whole Foods. Like, you're basically at home hiding, doing vinegar soaks. You might scare your kids. It literally like removes the layer of skin under your eyes, which sounds horrible, but it's not. And then the results, like 1 to 2 weeks later, I mean, it's like baby soft, beautiful skin under your eyes. I haven't done the Erbium Contour TRL. I'm gonna have Stephanie, my amazing laser nurse, do that to me this winter when I have the downtime, and I'll post it on, you know, YouTube. But I haven't even done it yet because it is a newer laser. Now, you're not gonna find like a laser like Contour TRL by Cyton everywhere. People say, well, I haven't seen that laser. Well, no shit, you haven't seen it, because it requires a high level of skill to even operate that device. That's like saying, well, my neighbor has, you know, 3 cars, but he doesn't have a jet in his garage, you're not going to find the jets around that, you need a pilot who knows how to fly the jet. That's what I'm saying. But, I don't think that contour TRL or Erbium is ideal for most people. I think that's for the person who wants like a one and done treatment. Their under eyes have been neglected their whole life, or they really want to like overhaul and smooth out the fine lines and wrinkles. I think a fractionated CO2, like the CO2 core, or I feel like Fraxel Dual or like a Halo, which is a hybrid of both lasers, I think would be great for under eyes. Now with the other lasers, not the contour TRL, the ones that are a little bit less aggressive, you would need more treatment. So usually it's about 3 treatments spaced 1 month apart to smooth the under eyes. And then after you achieve your new baseline with, you're happy with your under eyes, then you do it like once every year to kind of like maintain that. And so that's what I've been doing for, pretty much my 30s and 40s. I just do it maybe once a year. And if I really feel like I'm getting a little crepey under my skin, I'll do like a series of 3 of those lasers. But lasers are my favorite to smooth the under eyes because it's getting to the root of the problem. It's not just putting a band-aid on it. Like filler is the last thing I would do for somebody who has under eye wrinkles, because the reason why filler works is it puffs up the wrinkles, but then you're gonna need to add more, and people become distorted and they have these like puffy like under eyes, and it just like looks weird. So I would avoid filler for under eye wrinkles. Botox actually works really well if you do a little neuromodulator. Now, if you're a patient of mine, I do this all the time in my clinic. I do it on myself. I love it. Little, like 1 or 2 units here and here. So when you smile, you don't have those lines underneath your eyes. It works very, very well, but you have to be the right candidate with the right anatomical, craniofacial anatomy to be receptive to it. And if you're not, and if you're in my office and you've been seen as a patient, I'm like, no, we can't do under eye Botox on you. You're just not set up right for it anatomically. You have to know who is and who isn't. And for those who are, you have to do the right placement in the right amount of units. Because if you do too much, then you can get like an ectropion, or you can get shelving when you smile and it looks weird. But hopefully that would never happen when you go to an astute injector. So Botox, lasers, which are the holy grail. This is about to drop this month. I'll tell you guys more about it. This is my new sunscreen. I'm so obsessed with it. Oh my gosh. So a lot of people will say like, well, when I have a laser treatment, like how long do the results last? And that's a great question. And the answer is, the results after laser continues to improve for like 6 months after the treatment. And then once you have oh my God, this is like the silkiest, smoothest sunscreen. You guys sign up to receive emails about when it drops, because this is like my baby. Oh my gosh, I love this sunscreen. Anyways, people will say, well, how long are my results gonna last? Well, first of all, it takes like 6 months for the laser to fully like do its thing to show like the end result. And then after those 6 months, it can last for years. So the half-life of collagen that usually gets stimulated is about 6 to 7 years. But, during that time, you're going to continue to age. The laser doesn't stop the aging process. It just kind of reverses the damage that has been done so far and sets you up for being in a good position later on. But you're going to still continue to age. Your collagen is still going to continue to break down. Your elastin fibers are going to still continue to become sun damage, and laxity, fine lines or wrinkles, increased pore size, things like that are going to still continue. So it's not that the laser wears off, it's just you might have to do it once a year, once every couple of years, and depending on the strength of laser that you do for under the eyes determines how often you have to do it. So that's lasers. Then you have energy-based devices. So Thermage is my favorite energy-based device to stimulate collagen synthesis, and especially for under the eyes, it's great for that. You have to have insertion of an intraocular eye shield, which requires a higher level of skill. So again, you're not going to find these at medi spas on the street corner that are in and out of business and doing Groupons and things like that. You need such an excellent level of skill to even put an eye shield in that you're not going to be able to find a Thermage under eye treatment like anywhere. You probably have to go to a dermatologist's office, a plastic surgeon's office, and not a plastic surgeon that has a bunch of mid-levels doing the work for them, but somebody who's gone through a lot of training to even understand how to put an eye shield in. And also you need a special eyelid handpiece for the Thermage device, meaning you can't take the Thermage device that we use on the face and put it on the eyelids because that skin is thinner. The way the Thermage works is it's a transducer, and there's an arc of radio frequency that goes from one pole to the other. And if that skin is thicker, like on the cheeks, it's going to have an arc of radio frequency that goes down here. And you can't just take it and put it under the eyes because that skin is a lot thinner. You need that arc of radio frequency to be tiny for that thin, delicate skin to target it in the sweet spot. So basically what I'm saying is Thermage for under eyes is a specific eyelid handpiece, and you need intraocular eye shields. But when you do it, I've done it 4 times in my lifetime. I did it at my 30th birthday, at 35, 40, 45, and now that I'm almost 50, I'll probably do it again for my under eyes, but it's really helped keep my under eyes smooth and tight. And Thermage tightens and stimulates collagen deeper. And if you look at skin on cross section, it stimulates collagen deeper, like in the lower 2/3 of the skin, and then the upper 1/3, that's more laser. So sometimes we'll do something called like Thermofrax if we do Thermage and Fraxel, and then you're getting full thickness because lasers are up here and Thermage is down here for like more stimulation of collagen, which has like full thickness tightening. Now, Thermage is usually once every 5 years because the results last 5 years. It's a one and done treatment, and there's no downtime, and it doesn't. It's not a risk of hyperpigmentation like some of the lasers can be in olive tone skin tones. So, a large part of my fellowship was understanding which devices are safe and not safe to use in skin of color. But Thermage, you don't have to worry about hyperpigmentation at all, which is really nice. Now, Fraxel and CO2 and Erbium, sometimes you do, but it's all about the setting parameters and the aftercare with like melanocyte stabilizing active ingredients, which will help decrease your incidence of hyperpigmentation. So that's kind of the bullet points of like Thermage are energy-based devices, and then laser, which are light-based devices using photons. Both induce collagen synthesis. Both are going to smooth and tighten the under eyes. It just depends on, patient preference, your downtime, how long you want the results to last. Are you willing to have intraocular eye shields or not? Usually with lasers, we don't have to use intraocular eye shields. This is the orbital rim of the skull right here, the bone. If you can pull the skin over the bone and the bone separates the photons from hitting the globe of the eye, you don't have to use an eye shield. So sometimes a lot of my patients who come in for under eye treatments with lasers, they're like, Dr. Cabell, I don't want eye shields inside my eyeballs. And I get it. So what we do is we just kind of pull the skin down and we just basically laser. This is where the wrinkles usually happen anyway. So the intraocular eye shields aren't needed. We just put external eye goggles on you to protect your eyes. Okay, I'm gonna go to spin. Hi, my beauties. Okay, I just finished spin. Also, I have hot, sweaty, disgusting hair and no makeup on, but I wanna keep this authentic and real. So hopefully you guys don't pick me apart. Spin is my favorite cardio because unlike running, which can age you in the face, spin doesn't pull on your spaz and your facial ligaments, and it's just such a good workout. And my skin gets super red after a spin, so that's why I put my serums on before my workout, because especially my vitamin C FK will suppress the melanocytes, the pigment producing cells, so that I don't get a melasma flare. Because remember, hyperpigmentation and melasma is not just from sunlight and UV light, it's also from heat, sweating, vasodilation, hot yoga, spin, cardio, anything that makes your skin hyperemic like this. Like, look at my capillary refill. So it turns white and then it turns red. That's called capillary refill. That's because there's a lot of blood flow going to my skin, which is good for your skin health. It increases circulation, it removes impurities, it increases lymphatic drainage and supplies the skin with nutrients, but it can also upregulate melanocytes to hyperpigment. So that's why, if you saw me before, I put on my skincare before spin. Now I'm gonna go home and I'm gonna do my full skincare routine. And also back to our regular scheduled program of under eye treatments to smooth fine lines and wrinkles without surgery. See you in a sec. Hey guys, it is all hot and steamy in here. I just got out of the shower. So continuing on, we talked about lasers, energy-based devices, neuromodulators, and also different, I think those are all the modalities, non-surgical. So other treatments that are great for under eye fine lines and wrinkles, not filler. I think I touched on this earlier in this video, but filler is great for under eye hollows and volume loss, but now we have better non-filler alternatives like Easy Gel, which you can refer to in my other videos where I talked about Easy Gel a little bit more for under eye correction of under eye volume loss and hollows. But you never want to treat under eye wrinkles and crepiness and laxity by adding more volume, because then you could just get like puffy under the eyes, and nobody wants that. So we're not going to talk about fillers, and also we're coming out of an epidemic of people having like way too much filler. So Easy Gel is when we take your own blood products and we make a filler-like alternative out of your blood products. The proteins in the blood, the growth factors, and the fibrin and platelet-derived growth factors, PDGF, which is a hot topic right now also. That's a different video for a different time. A lot of you guys are going to probably ask me about PDGF, but Easy Gel actually has your own PDGF, which is platelet-derived growth factor, in it, which can help stimulate collagen and elastin synthesis to help smooth out under eye fine lines and wrinkles. So Easy Gel is another great option. Chemical peels sometimes are a good option as well. I don't personally do chemical peels in my office just because lasers are so much stronger, and that's my preference. But I do have oculoplastic surgeons who I refer to for like phenol peels or chemical peels. But remember, chemical peels are very superficial. So they don't tighten the under eye as much as you would think. And they don't really stimulate collagen and elastin and extracellular matrix proteins as much as you would hope for a under eye treatment when you're trying to smooth out fine lines and wrinkles. Okay, so we talked about energy-based devices, we talked about lasers. Obviously, we want to stay away from fillers because you never want to use a filler to smooth out fine lines and wrinkles under the skin, because volume loss is corrected by filler, but fine lines and wrinkles, if you just puff them out with more volume, then you're going to end up looking weird over time. And there's much safer, better alternatives than like under eye or tear trough filler for smoothing out fine lines and wrinkles. So filler is not even an option for fine lines and wrinkles under the eyes, in my opinion. Easy Gel, which is a filler alternative where we use your own blood products that are chock full of like growth factors and stimulants for collagen synthesis and elastin synthesis, which smooths out fine lines and wrinkles, is a great option. And you don't have to worry about the side effects of tear trough filler. So under eye, Easy Gel is great. If you want to refer to my last week's YouTube video, I actually talked about Easy Gel, but that's a great alternative to filler, especially if you're trying to smooth out the under eye fine lines and wrinkles, because the growth factors in your own blood products, nothing is added to it. And the way that it is heated and cooled and mixed in a certain way, no chemicals are added to the Easy Gel, but it lasts longer than like traditional old school like PRP or PRF, with really great collagen stimulatory effects. So basically, it just induces collagen synthesis from your own blood products and growth factors from your own blood. So this is different than like, I know PDGF, platelet-derived growth factor, is kind of like a hot topic right now. And I know a lot of you guys are going to ask me about that, but that's kind of like, the data's not, there's no real clinical sound scientific data. Where's my necktie? No sound clinical data supporting PDGF to be injected into the skin, although we know it does stimulate collagen. But I do feel that, instead of using exogenous PDGF, using Easy Gel and your own body's PDGF is a lot safer. And, I'm sure studies will kind of make that clear over time. But I always make sure I get my neck and décolleté. We'll make that clear over time. But for right now, I think Easy Gel contains the PDGF in addition to other growth factors and stimulants that can smooth out under eye fine lines and wrinkles. So refer to my other video for that, but that's another option. Chemical peels for under eyes works really well together too. I want to make sure my product's dry. Are they dry yet? No. We want to, talk about peels for the sake of, completeness, but peels are very superficial. I have an oculoplastic surgeon in the area who I usually refer to for like phenol peels, which I think could be efficacious, but peels are just really superficial and they don't really change the histological structure of the skin like lasers do. So I'm not going to do peels in my office when I have lasers, because I feel like they're much more effective, but peels can definitely make a difference too. Phenol peels, you have to be careful with other types of peels, because if the chemical gets into the eye, it can cause like a corneal abrasion or corneal ulceration, which you want to stay away from any ophthalmologic complications from a peel. So I think that's it, you guys. What else did I miss? Easy Gel, peels, neuromodulators, no filler, but we talked about filler. Lasers, energy-based devices. I think most of people might ask me about smooth threads. I'm not a fan of smooth threads for under eye collagen stimulation. I know some of you guys do like it. I used it back in the day. I think it's kind of old school. We have much better options now. And I think that's it. So at-home therapies that you can do for smoothing out fine lines and wrinkles, just be careful, because a lot of these at-home treatments, like even like the Dermapen and things like that, can cause hyperpigmentation. It can worsen things. I also want to touch on Thermage one more time, because I know some of you guys are going to ask me that Thermage can cause like melting of the fat. Remember, Thermage, just like any other treatment, is very operator dependent. And with the updated software platform and with a provider who knows what they're doing, fat atrophy should never happen. I've never seen it in my like 20-year career. All right, you guys, hopefully that helps. Putting on my retinol, I love to put on my sunscreen and call it a day. It was so great to get ready with you guys. And if you have any questions on any non-surgical treatments for under eye fine lines and wrinkles, please just leave a comment in the comment section and let me know what you guys want me to talk about next week. Okay guys, I'm just finishing up my stuff here. So I don't wear much makeup. Like I don't wear makeup on my skin, on my face. As you can see, I just have like my layers of skincare products and sunscreen, and then I put some shadow to line my eyes. My lash extensions are very low maintenance and save me time, and I just do some eyeliner and lower lid mascara. Usually I use this first. I don't even know what this is. It's like kind of like a primer, and then I use this on my lower lids, so I mean my lower eyelashes. So I like doing lower eyelash mascara. I feel like it just opens the eyes a little bit more. But most of my makeup is on my eyes because I really don't put anything on my skin. So that's it. Put my brow gel on, my lower lid eyeliner, which I actually have that like kind of tattooed on anyway. And then my mascara, and then I have my sunscreen on. I'll put on some lip gloss. I actually just like using this little lip stain. Hook off. And then I'm ready to go. I just have to blow dry my hair and get ready. I have to go pick up my kids. All right, you guys, hopefully this was helpful. Love you. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.